Our fourth and final talk in this series on the physiology of aging is focused on the musculoskeletal system. At the end of this lecture, you will be able to discuss the differences in musculoskeletal function in older and younger people and describe how these differences may account for increased risk of falls, the increased risk of skeletal injuries, and the decline in functional recovery after injuries seen in older people. So you'll remember from our last talk the 88-year-old Mr. Ahmed, who was found at the bottom of the stairs. During his initial assessment, he appeared to be in pain, but his x-rays were normal and he was discharged from the department without further assessment of his musculoskeletal system. However, 1 week later he returns with severe pain in his right hip, and this is the x-ray. I'm sure you can see the fracture of the neck of his right femur in this x-ray. We can pause the video at this stage so you can think about what factors in normal aging might have contributed to his fall and why this patient might be more prone to skeletal injuries such as the fracture of his hip. So let's think about the musculoskeletal system and aging. So there are changes in structure and function of the musculoskeletal system. There is what we call age-related sarcopenia or loss of muscle mass, which reduces proximal muscle weakness and along with changes and blunting of proprioception can cause problems with gait and balance. There are also changes to the structure and function of the skeleton with osteopenia, decreased joint mobility, and as we mentioned before, decreased proprioception. The clinical consequences of these can be predicted. Patients with weak muscles, particularly proximal muscles, and disorders of gait and balance, compounded by decreased joint mobility and decreased proprioception, are clearly more likely to fall. So there's an increased risk of falls, and most of these falls are what we call ground level falls, not falls from a height, and by and large they occur at home. However, they can be a lot more devastating in older people. Because of their osteopenia and osteoporosis, they are at increased risk of fractures, and both the fractures and other musculoskeletal injuries take longer to heal because the healing process is also impeded in the older patient. It's really important to understand that all of this is related to baseline physical activity. So the first thing to understand is that one way of reducing the musculoskeletal morbidity and injury burden in older people is to make sure that we encourage younger people to have an active, healthy lifestyle which improves their functioning in older life. In addition, at any age, increasing physical activity, under careful supervision of course, will increase mobility, functional capacity, bone density, and muscle strength in older patients, but in fact in patients of any age. And all of these things help to reduce the risk of falls in older people and also reduce the risk and severity of injury if an older person falls. So, when we think about falls and musculoskeletal injuries, The consequences in an older person are related to osteopenia, sarcopenia, joint stiffness, and loss of proprioception, all of which come together to increase the risk of falls in older people and increase the risk of injury after any trauma in an older person. Again, if there are any questions or comments, you can post them on the WhatsApp group or on the TTEMA website, and we will try to get back to you. In summary, there are changes in the musculoskeletal system in older people which increase the risk of falls and injuries, and these include sarcopenia and osteopenia, decreased joint mobility, and decreased proprioception. It is also worth noting that falls are often a sign of functional decline in the older person. This brings to a close this 4-lecture series on the physiology of aging. I hope you learned something, and I hope that what you have learned you can apply to your day-to-day clinical practice. Thank you.